Estate and Old Town Mombasa in a bid to curb the rising numbers of those testing positive for coronavirus. We are aware that the measures may cause some inconveniences, but we are appealing to you all for understanding. These directives are aimed at protecting all of us. We have observed that arising from the directives, some people have decided to sneak out of these areas and to relocate to the neighboring estates. Let me caution that this move is counterproductive and dangerous. This is because if you happen to be infected unknowingly, then you have just transferred the problem to another area. What you have done is to promote the spread of the disease in this area that you have relocated to. And I want to address the measures that were taken, particularly in Eastleigh and in Old Town Mombasa. I want to address my fellow Muslim brethren because they are the majority in these neighborhoods. Indeed, I want to start by wishing them Ramadan Kareem. This is the holy month of Ramadan. It is a month of worship, and generally when things are normal, it is a month that brings people together. But it is also a month that brings the best out of people. And this holy month, everybody strives to do the best that they can be in every way they can. And I want to look at this in the context of the pandemic that we are facing right now. You also know that in extreme difficult times, it is also the time that brings the best out of people. So we have an opportunity here to bring the best out of ourselves on those two fronts of the religion as well as the pandemic itself that faces us. And I want to narrate the hadith about Prophet Muhammad, peace be upon him, who said, if you hear that there is plague in a land, do not enter it. And if you are in a land and it is visited by plague, do not leave it. That is a real hadith that is there, and it is basically the cardinal principle in public health control of contagious diseases. That is, infectious diseases spread through community spread. It's the basic principle. It is as if this principle was borrowed from the religion. And I want to say that if we look at this, it means the measures that have been put in place in these two areas are meant to prevent people, one, from moving out and spreading the disease. And remember, this is a disease that is new, that we learn something every day about it. This is not a disease that has clear signs that we can identify who's carrying it or not. It is a silent disease in many ways. We have kept talking about the number of people who are asymptomatic. They do not show any signs or symptoms of this disease, yet they are carriers and are shedding the virus. Under such circumstances, it is safe to assume that each and every one of us is infected. If we make that assumption, then we need to adhere to the only weapon that we have of controlling this disease, which is all the measures that we have been talking about. Social distancing, physical distancing, hygiene, wearing your masks, keeping to yourself and avoiding gatherings, staying at home when you can do that, Those are the only measures that will break the cycle of transmission. As I address these two areas of Eastleigh and Old Town, I want to appeal to everybody to please remain within these zones that have been marked as restricted areas of movement. We are aware that there are, since the announcement was made yesterday, that people are sneaking out in one way or the other and going to other neighborhoods, South B, South C, and others. As I started off by saying, this brings the best in us. Remember, with a silent disease like this, one can be a silent killer. By moving out, there are the chances that you will be spreading this disease to others. You may not know that you are a carrier, but we have been telling you, you must assume you are a carrier because of the nature of transmission of this disease. Therefore, if you are leaving a place that is already a high-risk zone and going to another neighborhood, you are spreading the disease. And that should be on your conscience. Equally, and I want to again remind you of the hadith that I mentioned. Equally, if you are in a place that is visited by the plague, you do not leave that place. If you hear there is a land where there is a plague, you do not enter that land. So, for those family members or community members who are welcoming those who are coming from the high-risk areas that we have earmarked, you are also placing yourself in danger. Placing yourself in danger by bringing to your home, even if they are your kin, people who may be able to spread the disease to you. We therefore are appealing again to those neighboring communities that may have kin and relatives within the earmarked areas, that when you bring in people who are coming from these areas, you are putting yourself at risk, and we want you to desist from that. Those who are within these areas, we ask you to please remain in there, because when you're in there, the health workers are in there. You will watch out for whatever symptoms. If you feel that you have any symptoms or need medical care, you will be able to contact the healthcare workers. You can call 719, and healthcare workers will come in there to attend to you, to test you, and to see what course of action that they will take on you.